Now let's see how many types of diabetes are there. Essentially, there are two types of diabetes. First is called type 1, where there is total absence of insulin. The second is called type 2, which starts as a relative absence of insulin, and we will discuss both of them in detail soon. Other types of diabetes include post-surgical, where the pancreas is removed by surgery and so there is no insulin available and that causes diabetes. Pregnancy diabetes, or also called gestational diabetes, where the diabetes occurs for the first time during pregnancy, disappears after the birth of the baby, and in many cases it may reappear as a full-blown diabetes later on in life, and we will discuss this topic separately. Some medication like steroids, when given to treat asthma or rheumatoid arthritis or such chronic conditions, can cause diabetes because they interfere with the glucose metabolism. So these were uncommon causes of diabetes, but the common types of diabetes are type 1 and type 2. Now let's see what is type 1 diabetes. Type 1 diabetes, also called T1 diabetes, happens in younger people who are below 25 years of age, is more common in Caucasian or white people. The exact cause is not known, but it appears that either an infection or something called autoimmune process damages the pancreas where it forms insulin, and as a result these patients have total absence of insulin. There is no insulin available in these patients. As a result, we can understand the only treatment that is available for these patients as of now is giving insulin injections. There have been some trials of giving insulin as inhaler, and that's not a common mode of insulin administration yet. So type 1 diabetes happens in younger people below 25 years of age. There is no insulin, so the insulin need to be provided from outside the body, and most probable cause is either an infection or autoimmune destruction of the pancreas where it forms insulin. So these patients also have antibodies, something called antibodies, which damages pancreas in their blood. So if you check their blood, they will have antibodies, and that will become important when we talk of another type of diabetes soon. Because there is total absence of insulin, these patients are more likely to get high sugars, and because they need big doses of insulin to control their sugar, they are also more likely to go into low sugars. So they can get very high sugars, they can get very low sugars, so they are a challenge to treat sometimes. Also, because these patients are young, it is difficult to manage the diet and the nutrition because they are in college, they are in school, they are playing, they are active, and all those things affect the blood sugar level. Now let's see what is type 2 diabetes. It is also called T2 diabetes or T2, and in this type of diabetes there is a relative absence of insulin. So the insulin is there but not as much as is required. As a result, these patients can be treated in many different ways. Let me explain that. Suppose a patient weighs 180 pounds and needs, for example, 180 units of insulin. But the body can only make 160 units of insulin. As a result, these patients are deficient by 20 units. Now, here is where options come in play. Either we can supply extra 20 units of insulin as injection to these patients and then their need for insulin will be met, or we can push the pancreas by giving some tablets daily that the pancreas makes more insulin, and now the pancreas where the insulin is made is stimulated, pushed to make 180 units so that they can meet their daily demand for insulin. The third way is that we can make the available insulin work more efficiently. So even that 160 unit which is there will be able to do the job of 180 units. The fourth option is that if the patient loses weight and comes down to say 160 pounds and then he needs 160 units of insulin, and these are imaginary numbers, but this is to give the example, then this patient will not need insulin anymore or will not need any treatment for diabetes anymore because the patient has enough insulin in the body as required by the body. We will talk about various approaches to treating diabetes in a separate presentation, but suffice it to know that type 2 diabetes occurs in people who are over 35 years of age. Many of these patients can be slightly or significantly overweight, because when you have more weight you need more insulin, and if the body can not produce that much insulin, you get diabetes because of deficiency or lack of enough amount of insulin. These patients' diabetes can be treated by dietary management, by weight loss, by physical exercise. If it's a mild diabetes, it can be treated, or even if it is significant diabetes, it can be improved by taking these measures. Compare this to type 1 diabetes. Those patients are not overweight. They have absolutely no insulin. So all these things, dietary modification and exercise, will not control their diabetes. Of course it will help, but basically type 1 diabetics will need insulin. Type 2 diabetics can be managed with tablets, or if it is very mild, type 2 diabetes can be managed by dietary modification, exercise, and change in lifestyle. Now the question comes, can type 1 diabetes happen in older patients who are more than 25 years of age? The answer is yes. In rare cases, and it is very new, it is just being studied in detail, that if some patients where the pancreatic damage started late, then these patients can have type 1 diabetes even if they are above 25 years of age. The distinguishing feature will be that they will have antibodies against pancreas just as type 1 patients had. Type 2 patients do not have antibodies against pancreas. So these patients who develop type 1 diabetes at a later age will have antibodies against the pancreatic components, and now they are being labeled as diabetes type 1.5 or T1.5. You will hear this term probably more frequently in the future, but the number of these patients is very small. These patients, because they are above 35 years of age or about 25 years of age, may be started on tablets, but very soon will need insulin because there will be a rapid decline in pancreatic function and rapid decrease in insulin levels, which will go down to zero pretty soon. And so these patients start requiring insulin very early. Now another question, can type 2 diabetes happen in younger patients? And the answer again is yes. We saw type 2 diabetes is because of a relative lack of insulin. So if a young child, say somebody who is 18 years old and weighs 300 pounds, and the body can only make up to 250 units of insulin, there is a limit to what body can make insulin. So if the body can only make 250 units of insulin in a day and the person weighs 300 pounds, then there will be a gap or lack of 50 units. So this will be a type 2 diabetes because there is not an absence of insulin, there is a relative lack of insulin, there are no antibodies against pancreas, but because the patient's weight is so much that the pancreas is unable to create that much insulin. So these were the various types of diabetes. This gives a little idea about who needs insulin, who can be controlled with diet, who can be controlled with exercise, who can be controlled with tablets, and what is the relationship between tablets, insulin, and patients' diabetes. Now, one point to add, since we are seeing an epidemic of overweight children, it is very likely that in the future we will see many more cases of type 2 diabetes happening in younger people.